Today I want to talk about crowns under partials. These kind of cases are something that dentists routinely don't like to do because they can have a lot of adjustments. And today's case is a prime example of one of the reasons that you can have a lot of adjustments. So we received a case in for a crown under partial, and the dentist took a preoperative impression, which is perfect. When you make a monolithic crown digitally, if you make an impression of the pre-op, we can scan that impression and copy mill the restoration to fit the partial, so the patient doesn't have to give up the partial as you send it to the lab. They can keep the partial, and you don't have to take a matrices of the clasp and breast, which can be inaccurate and cause problems also. But it is critical that the preoperative impression has no voids or pulls in it, otherwise it's going to make the lab's job difficult as we guess where to put the contours. So I have the preoperative model here after we've scraped off the pulls, which you can see in the photo. Had we designed the crown to match these pulls, the doctor would have never been able to get the partial in the mouth. So this is just a little tip to talk to your staff when you're doing these alginate impressions as your pre-ops and pouring them in your office. You've got to check these for pulls or drags before you send them into the lab. But this is the correct way of doing a crown under partial with a conventional impression technique. Now, if you have a scanner, all you would do is just scan the mouth before you prep and send both pre-op scan and prep scan. So I hope this tip helps your seating appointments to be faster and easier. Thank you so much.